Good afternoon to all our viewers. Namaste. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, every 3 times a week, I come up with new topics or subjects relating to Ayurveda, mental health, or psychotherapy, and other related aspects. So, today's topic of discussion revolves around some of the common myths prevailing, around Ayurveda and debunking those myths. So, before getting into debunking those common myths, in my previous to previous session on why is Ayurveda unique and the unique and exclusive characteristics that differentiates Ayurveda, I had mentioned all the points, but because of the time shortage, I couldn't mention on Acharya Sushruta's contribution to Ayurveda and surgery. Most of you might know that Acharya Sushruta is the first surgeon this planet has ever seen. So this has been documented in modern medicine as well. So Hippocrates and other modern, ancient allopathic doctors and researchers have given credit to Sushruta for his contribution. So I would love to, mention a few contributions of Sushruta. Before that, thank you for giving me a huge applause, and I've got many messages for why is doing a YouTube video on why is Ayurveda unique and the exclusivities and what are all the treatment options in Ayurveda. Everything. If you want to check the video out, it will be in the playlist, and links I'll provide in the description. So let's get started. So first, Sushruta. See, Acharya Sushruta is commonly known as Sushruta, was an ancient Indian physician and first surgeon on this planet who made significant contributions to the fields of Ayurveda and Shalya Tantra. We call Shalya Tantra for surgery. There, it is a coined word in Ayurveda called Shalya Tantra. Surgery is Shalya in Ayurveda. So, his most notable work is the Sushruta Samhita, a comprehensive treatise on medicine and surgery, which remains a valuable text in Ayurveda to this day. So, what are the other contributions of Sushruta? Is first, Sushruta Samhita is a compendium of medical knowledge that encompasses a wide range of topics related to Ayurveda and surgery. So, and Sushruta was the first physician ever to concentrate and to start, anatomy of the body and dissection of the dead body. So he was the first physician to initiate anatomy and dissection. So one of the Sushruta's remarkable contribution was his understanding of human anatomy. He recognized the importance of anatomical knowledge for surgical procedures, and is said to have performed dissections on cadavers to gain insights into human body structures. He was the first surgeon or the physician who has done this. His detailed descriptions of various organs, tissues, and body parts, bones, and etc., are there in Sushruta Samhita. So, and Sushruta has also designed many of the surgical instruments which are even used today. So he has designed and developed a range of surgical instruments that were advanced for his time. So these instruments were primarily made of metals like bronze and iron, and were used for performing various surgical procedures. His descriptions of these instruments in the Sushruta Samhita highlight his mastery of surgical techniques. So next is plastic surgery. Sushruta is, perhaps one of the most fascinating aspects of Sushruta's contribution is his work in the field of plastic surgery. He is also the first plastic surgeon on this planet. He devised innovative methods for reconstructive surgery, such as repairing torn earlobes and reconstructing noses. These techniques were primarily used to help individuals who had suffered injuries or deformities. Okay, all these, are some of his techniques are even used today in the modern medical field as well. And classifications of surgery. Sushruta categorized surgical procedures into different classes based on complexity and risk. So he emphasized the importance of thorough training and knowledge for surgeons before attempting any procedure. His classification laid the foundation for surgical education and ethics in ancient India. So, apart from this surgical expertise, he was also an expert in medicine. He had medicinal knowledge as well, that is Ayurvedic medicine. Sushruta made significant contributions to medicinal knowledge as well. He described various medicinal herbs, their properties, their applications in treating diseases. So, the Sushruta Samhita includes a comprehensive materia medica that serves as a valuable resource for traditional medicine even today. And Sushruta also recognized the importance of prevention and hygiene to maintain health. He advocated for proper dietary habits, cleanliness, and a healthy lifestyle to prevent illnesses and promote overall, well-being. And innovative surgeries as well. So, Acharya Sushruta's contributions to Ayurveda and Shalya Tantra, that is surgery, have left an indelible mark on the history of medicine, that is Ayurvedic medicine. His work continues to inspire modern medical practitioners, and the principles laid out in the Sushruta Samhita remain relevant in the study and practice of Ayurveda as well as surgery. So after this, I think this was only the excluded part in what is unique about Ayurveda. I didn't talk about Ayurvedic surgery there. Ayurveda, specializes in anorectal surgeries like hemorrhoids, fistula in etc. Many of the anorectal surgeries are being carried out in Ayurvedic surgical department. So these are all the major contributions of Sushruta and also Ayurveda. So coming to today's session. See, today's session, as I said, is debunking some myths on Ayurveda. There are so many myths revolving around Ayurveda that makes people difficult to understand the exact authentic Ayurveda. So, we'll try to debunk some of the myths today. So, Ayurveda, the first myth people have is everywhere, even other medical practitioners also feel that Ayurveda is not based on scientific principles, or Ayurveda is not evidence based. This is a commonly misheard myth. So that, and people say that Ayurveda in some countries is not a legal practice. That's why it makes people, common people, to proceed with their treatment in Ayurveda because of this myth that Ayurveda is not scientific. So what is the actual fact? Ayurveda is a legal practice, evidence based practice. It has been time tested, authentic and experimented and practiced for years, and then laid down into foundations of samhitas, and then we are today's modern Ayurvedic doctors or vaidyas are practicing from those samhitas. And see, Ayurveda is a legal practice that has practitioners who are well equipped and trained. We are also, Ayurvedic doctors are also have a intensive course of a 5.5 years course. BAMS is a 5.5 years course, almost 6 years course till you get your degree. Usually the graduation is minimum 3 years or maximum 4 years. For us doctors it is 5.5 to 6 years. It is almost double. So, they believe many problems that are faced in today's population are because of the doshas present in our body. So, they don't require any, Ayurvedic doctors are well trained, and Ayurveda is a documented evidence based practice. See, while Ayurveda's ancient roots are ancient, but it is based on well defined scientific principles. Ayurveda in those days was called Mana Pramana. Mana means which can be measured. So everything in Ayurveda can be measured. The quantity, the dosage, the time period, etc. Everything can be measured. So it was called Mana Pramana. And Ayurveda encompasses a deep understanding of human physiology, anatomy, and pathology. So it emphasizes, all the and many Ayurvedic practices have been validated by modern scientific research. It is also research based. And Ayurvedic herbal herbo-mineral formulations are studied for their therapeutic properties. All this is being done. That means randomized controlled trials and researches are being done for Ayurvedic medicines as well in various sectors. So firm guidelines have been established for the quality council and standard of Ayurvedic medicines in the country. So, Ayurvedic medicines has quality control and standard Ayurvedic practices, and the Pharmacopoeial Laboratory of Indian Medicine PLIM and the Central Council of Researches in Ayurvedic Sciences CCRAS. See, they have published the protocol for testing Ayurvedic medicines. So, there is a Rule 160 that has been instituted in drugs and cosmetics for the quality control and standard of Ayurvedic medicine, which ensures the establishment of drug testing laboratories throughout the country. So, the drugs which are manufactured are thoroughly tested. So, it is mandatory for the Ayurvedic medicine makers, manufacturers to get certified from these laboratories regarding the quality and stability of their product. So, here we busted another myth that Ayurvedic medicines lack clinical testing. So, Ayurvedic medicines do have to undergo intense clinical testing thoroughly. Okay. So, we have busted, two myths here. Ayurveda is not scientific principle, based on scientific principles, and Ayurvedic medicines lack clinical testing. The next myth is, and the most common myth is, you know, Ayurvedic medicines, don't need a prescription. So Ayurvedic medicines are the herbs which are found in kitchen. Ayurveda is a kitchen based medicine. This is a complete myth. No. People often tend to assume that Ayurvedic medicine don't need, a practitioner's prescription. But you know, most Ayurvedic herbs are actually, they are not harmful, but even safe medicines can sometimes act as a poison according to Ayurveda if they are used in, wrong scenario or for wrong disease. So don't consume Ayurvedic medicines without prescription. And when it comes to, kitchen, turmeric is Ayurveda, ginger is Ayurveda, tulsi is Ayurveda. See, all these are herbs. Turmeric, uh, curcuma longa, ginger, Zingiber officinalis, tulsi, Ocimum sanctum or Ocimum indicum. All these are herbs. This is not Ayurveda. What is Ayurveda then? How to use turmeric, when to use turmeric, in what conditions we can use turmeric, in what conditions we cannot use turmeric. That is, what are the indications, contraindications, what is the dosage of turmeric, what is the time period that we have to use the certain herb, you know what are the combinations that can be made to, make it maximum bioavailable. Is it is it has to, it has to be consumed as a pill or quatha or a decoction or a powder churna form, in which form it has to be taken, and what is the anupana, with what, with water, with lukewarm water, with hot water, with lemon juice. What is the anupana? What to be done before taking it? What should be done after taking it? All these and many more things are involved in Ayurveda. So basically, don't presume that Ayurveda, the ginger, the tulsi, and the turmeric are Ayurveda. No. What are the medicinal properties in them? And how to use it, in what form, all these comes under what Ayurveda. And yukti of the doctor. And there are lakhs of formulation, herbal formulations, herbo-mineral formulations, which can be used to treat different conditions. So Ayurveda is not a kitchen based approach. So you have to consider, you have to consult registered Ayurvedic practitioner, either BAMS or BAMS MD. And then you have to take Ayurvedic treatment. When it comes to treating certain ailments, medicines are necessary along with lifestyle changes and dietary adjustments. With and Ayurvedic treatment is no different. So Ayurveda is a protocol based therapeutic system which requires more than just changing lifestyle and diet and a kitchen herb medicine approach. So, medicines are necessary to reverse certain illnesses. So, we from this we what we knew is that now Ayurveda is a time-tested system of medicine with a strong foundation in scientific principles. Next common myth that I hear from my clients as well is Ayurvedic medicines are slow and ineffective. So this is also half myth and half true. See, the prescription of the Ayurvedic medicines, start working. We are not giving any magic pill. So that's right. That soon after you take a medicine, it is not a chemical. It is a herbal or herbo-mineral formulation. So it takes time to it takes certain time to act and you to find benefits and to be relieved of your symptoms. But however, notice that you are getting benefits and your symptoms are being relieved after a few weeks of starting your medications. And you have to take Ayurvedic medicines for a period of time, prescribed period of time according to the necessity. And here comes the ineffective part. No, Ayurvedic medicines are very much effective. and are as effective or more effective than any other medical systems. So the perception that Ayurvedic medicines are slow and ineffective is not entirely accurate. It is half, yes, it may show benefits over a period of time, but it is not ineffective. The effectiveness of any treatment, including Ayurvedic ones, depends on various factors. So what is the severity of the condition, what is the duration of the treatment, and how is the patient responding to the treatment. And Ayurvedic treatments, when prescribed correctly and followed diligently, can produce significant and long lasting results. See, the main aim of Ayurveda itself is Vyadhi Parimokshana, that to wipe the disease out from its root cause. So, it is helpful in the recurrence part as well. So, another myth. We have debusted this myth that Ayurvedic medicines are very slow and ineffective. So the next myth is Ayurvedic medicines are some people say Ayurvedic medicines are not safe and may have side effects. This is a few population says this, and some people say that as the Ayurvedic medicines are completely safe and have no side effects. Both of them are wrong. Both of them are myths. Like any medical system, the safety of Ayurvedic medicines depends on the quality of the ingredients used and the expertise of the practitioner, and what are the drugs you are taking for what illness. So when prescribed by a qualified Ayurvedic doctor and sourced from reputable manufacturers, Ayurvedic medicines are generally safe. So but you have to take only the prescribed medicines. See, and one more thing is Ayurveda does not have side effects is also false. How? See, anything that can have an effect can also have a side effect when it is not taken diligently, when it is prescribed to for a wrong disease and a wrong patient is taking it in a wrong way, in a wrong form. All these things can lead to side effects. However, adverse effects from Ayurvedic medicines are not reported. Adverse effects is serious effects like death and serious emergency conditions. So um, the point here is a medicine, anything that can have an effect can also have a side effect. But how? In case the prescribed medicine or therapies are not followed in an appropriate manner, if the Panchakarma is prescribed and it is not done in an appropriate manner, in a prescribed manner, then it may have side effects. So, there is a saying in Ayurveda, even Amrita in excess can become Visha, and even Visha appropriately used can be become Amrita. That is, even nectar, if you consume excessive Amrita, that becomes Visha, that becomes poison. And even poison, the Visha, which is consumed appropriately in a prescribed manner, can act as Amrita. So that's what they use anti venom in snake bites. That is the best example. The venom is also made use of in appropriate quantity and through the appropriate techniques. And the next myth is Ayurvedic, medicines are only herbal. No, yes, the Ayurvedic medicines and are not regulated. See, Ayurvedic medicines have herbal preparations, herbo-mineral preparations, external purification and internal purification. See, Panchakarma as well. Panchakarma are the purificatory therapies. So all these are there. Ayurveda is not just the herbal medicine or the herbal remedies. The herbo-mineral mineral mineralogy is called Rasa Shastra in Ayurveda. So Ayurvedic treatments are herbal and herbo-mineral. So Reputable manufacturers adhere to quality control standards, and Ayurvedic practitioners are licensed and regulated in various regions. In India, for instance, there are government bodies like the Ministry of Ayush that oversee Ayurvedic medicine production and education. So, Ministry of Ayush controls the entire medical Ayurvedic medicine sector in India. And as I said, that Ayurveda is not about only, herbal remedies and treatments. So Ayurveda is a comprehensive system of medicine that includes various therapeutic modalities, including diet and lifestyle recommendations, yoga and meditational practices, and Panchakarma purificatory therapies, often known as a detoxification therapies, but it cannot be directly correlated to detoxification, but it can be considered one of the things that Panchakarma does is detoxification of the body. So, and Abhyanga, Purva Karma, we have pre Panchakarma therapies, post Panchakarma therapies. We have Abhyanga, we have different types of massages, everything. Not the massage and spa. This Ayurvedic massages are different. They are given for diseases and for appropriate, they are prescribed by the practitioner for appropriate medical conditions. So it emphasizes preventive health care, personalized wellness plans, and disease management. Everything, Roga and Rogi, both are taken into consideration while treating. The disease and the patient, both are taken into consideration while treating in Ayurveda. So Ayurveda is not complementary. The another myth is Ayurveda cannot be a complementary medicine to modern medicine, or Ayurveda is incompatible with modern medicine. See, there are many researches going on that Ayurveda can play a complement as a complementary medicine to many of the severe illnesses. Example, one of such example is cancer. So many individuals, as Ayurveda can be complementary to modern medicine, many individuals use Ayurveda alongside conventional treatments to support their overall health and well-being, that is for holistic wellness. Integrative approaches can be beneficial, but it's crucial to communicate with both Ayurvedic and allopathic healthcare practitioners under the supervision of both, to ensure there are no conflicts or interactions between treatments. So, this is also a myth. And another myth is Ayurveda is only suitable for minor ailments or chronic illnesses. Ayurveda cannot treat serious conditions. This is also a myth. Ayurveda can address a wide range of health conditions, including chronic and complex diseases as well. While Ayurveda excels in promoting overall well being and preventing illnesses, it can also be used as a complementary therapy for various serious health conditions when appropriately integrated with conventional medical care. Either it can be used alone for chronic illnesses, or in some cases it can be integrated with the modern medicine as well. So this is also a myth that Ayurveda is only suitable for minor ailments, not for serious conditions. And another myth is Ayurveda is only for physical health. It does not address mental health or psychological issues. No, this is a complete myth. I am an Ayurvedic psychotherapist. Ayurveda recognizes a close connection between the mind and body. Ayurveda, as much as it is physical, it is psychological as well. There is a branch of Ayurveda which is called Graha Vidya or Bhuta Vidya, which is Ayurvedic psychiatry and Sattva Vajaya Chikitsa. So this is Ayurvedic psychotherapy. So we have, Ayurveda also addresses mental and psychological issues. So counseling, meditation, lifestyle modification, all these are, addressed, and all these are used to address psychological well-being and emotional balance or regulation. So, this is also a myth that Ayurveda definitely addresses mental health and psychological issues. So, next, myth is Ayurveda is against curd, milk products, meat, alcohol, and sour things. See, first we'll address one by one. Ayurveda is against curd and milk products. No, if a person is healthy, there is no restriction on the food they consume. There is, no restriction on the food. If they are used to having curd and milk in their diet, there is no restriction. And if you want to know about milk, many people ask me whether I should drink milk or not. Whether the white milk is bad, cow milk and the buffalo milk are bad for health. This is always the question I get. See, to understand this, first we have to understand that milk, is digested by the enzyme called lactase. So lactase is very much present in, children. So children can digest milk easily, and after the age of 12 or 13 it gradually decreases. However, it is, present in certain amounts. Lactase, is present in certain amounts in most of the individuals. For some, there is lactose intolerance. This word people might have heard, lactose intolerance. Only for the people who have lactose intolerance, they have severe diarrhea or nausea, or they can't digest milk, they have bloating and abdominal pain digesting, in only in those, and gut issues, only in those conditions milk should not be consumed. Otherwise, what in Ayurveda says is that you can, and all those can also be, the all those ill effects can also be balanced by, adding turmeric, pepper, ginger, and herbs like this to the hot milk. So when you add these things, they balance the, milk, non-nutrients of milk, and they make it easy to digest. So in India, it is ancient practice of drinking haldi wala doodh, turmeric milk, adding pepper, ginger, etc. herbs according to their, preparations, according to their procedures. They add cinnamon and etc. 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 They might add many things, mint, cinnamon, etc. So, and this is the scientific part of it, why milk cannot be digested by some individuals. So the the ethical part of it is, in ancient, days, cows were ethically treated. They were not forced to give more milk or produce more milk by injecting hormones. What these hormones does is, the hormones get in the way of milk as well, and milk we drink, when the hormones are injected to the cow, those hormones enter into the milk as well, and it affects our human body of the human beings in a negative manner, causing sometimes acne and PCOD related issues and gut health issues. So this becomes a problem. As it is, cow milk is not a problem. When cows are injected by hormones to produce more milk, that is a problem. That is a big no. And in the ancient days, what they were doing is, when calf was born, they were giving the milk, some portions of the milk or the half portion of the milk to the calf also, and then they were rest of the milk was used for drinking. So nowadays that is not happening. When the cows are happy feeding their calves, the milk, the quality of milk is also superior, cows and buffaloes in general. So these are the ethical problems. I have explained the scientific problem as well in milk. Otherwise, milk can be consumed moderately. You know, there is no restriction on the milk or curd or ghee. In fact, ghee is highly indicated in Ayurveda to increase the intellect. You know, ghee is highly indicated. So everything can be consumed moderately. So ati sarvatra varjet. Excessive or overindulgence of anything or anything is wrong. So, and in fact, from person to person, prakriti to prakriti, we can say that few people cannot consume curd or milk, or curd cannot be consumed at night. Some exceptions are there, rules are there, exceptions are there. But apart from them, you can. There is no Ayurveda is not against consuming curd, milk products. So next comes the important part, that only vegetarians can benefit from Ayurvedic treatments. That is, Ayurveda is against meat consumption. No, Ayurveda is actually, this is commonly asked question, is Ayurveda against meat consumption? No, Ayurveda is not against meat consumption, and Ayurveda does not exclude meat from the diet. And it is the individual's preference that wants to be vegetarian, or one wants to be a non-vegetarian. In some of the conditions and diseases, consuming non-vegetarian foods are indicated in Ayurveda. So it is, commonly believed that Ayurvedic practices only include veggies and no onions or meat. No, the truth is that many Ayurvedic doctors actually recommend the consumption of onion and garlic, owing to the great medicinal properties the both has to offer. And Ayurveda is not against onion and garlic. So, and all those things, and the meat as well, in most of the diseases, eggs, chicken, and mutton soup, etc., are prescribed in Ayurveda. It is the choice of the individual, but to be vegetarian or non-vegetarian, Ayurveda leaves it up to you. And most of the emphasis is on vegetarian food, on vegetables, pulses, lentils, leafy vegetables. Yes, lot of emphasis is on that, but it does not exclude meat consumption. So, and one more myth is Ayurvedic medicines are herbal and does not have expiry date, expiration. There is no expiration for Ayurvedic medicine. No, it is a complete myth. And if it is Ayurvedic, any medicine or any product has an expiry date. So, if it is Ayurvedic, it does not mean, if it is herbal, that it does not have an expiry date or expiration. It is man made, it has an expiry date. And it might be possible that sometimes Ayurvedic medicines have long shelf life. Few of the medications, asavas and arishtas, ashavas and arishtas are fermented drinks, and they have a bit of alcohol content, not the beer and whiskey, but the fermented alcohol content, the good alcohol content. So some of these formulations can be preserved for longer shelf life. However, Ayurveda and herbal products have an expiry date. So please check the expiry date before you consume Ayurveda. Ayurvedic or any herbal or any medicines or any prepare herbo-medical herbo-mineral formulations for any, while you take any of the herbo-mineral formulations, please check the label and expiry date. Okay, it is mandatory to mention the expiry date on the label. Okay, and another myth is that Ayurveda does not have any branches. This is also a myth. Ayurveda does not have any branches. Yes, Ayurveda prefers whole person healing or holistic healing rather than symptom based and organ based healing. But Ayurveda also has different branches. See, and each branch focuses on different aspects of health, medicine, and well-being. First is Kaya Chikitsa, internal medicine. So, internal medicine is the first branch of Ayurveda. So next is, what Kaya Chikitsa deals with is diagnosis and treatment of various diseases affecting the internal organs and the systems of the body. It includes herbal remedies, dietary recommendations, and lifestyle modifications to restore balance and health. First is Kaya Chikitsa. Second is Bala Chikitsa, pediatrics. First is internal medicine, Kaya Chikitsa. Second is pediatrics. Second branch is pediatrics, Bala Chikitsa. That is, it focuses on the health of Bala Chikitsa, focuses on the health of infants, children, and adolescents. So it includes preventive and therapeutic measures to support the growth and development of children. So the third branch of Ayurveda is Graha Chikitsa, that is psychiatry. As I said, it is also called Bhuta Chikitsa. So it is the third branch. So Graha Chikitsa deals with the diagnosis and treatment of mental and psychological disorder. It emphasizes therapies to balance the mind and address emotional imbalances. So psychiatry, Ayurveda also deals with psychiatry. Next is Urdhva Chikitsa. Urdhvanga Chikitsa or Urdhvanga Chikitsa. What is Urdhvanga Chikitsa? Is ophthalmology and otorhinolaryngology. So everything, ENT and ophthalmology. So this Urdhvanga Chikitsa is both ENT and ophthalmology. So what it does is it is concerned with the diagnosis and treatment of diseases of ear, nose and throat and the eyes. So it does majorly this. The fifth branch is, as I said, surgery, Shalya Chikitsa. So surgery is the fifth branch of Ayurveda. What it deals with the surgical techniques for the treatments of various conditions, if for injuries, for fractures, for tumors, for hemorrhoids, and as I said, Ayurveda specializes in anorectal surgeries. So, Shalya Chikitsa or surgical techniques are, emphasizes on the surgery. Next, Damshtra Chikitsa. Sixth branch is called Damshtra Chikitsa. Damshtra Chikitsa is toxicology. Yes, toxicology is also mentioned in, Ayurveda. The Damshra Chikitsa focuses on diagnosis and the treatment of toxicological conditions caused by various poisons and toxins. These toxins can be from animals, from plants, from reptiles. Different aspects of toxicology are discussed in Damshra Chikitsa. Next comes the seventh one is Jara Chikitsa. Jara, it's geriatrics, diseases relating to old age, geriatrics and rejuvenation. So, this is the seventh branch. So, Jara Chikitsa deals with the management of age related issues and rejuvenation therapies to promote longevity and vitality. So geriatrics is also very much popular in Ayurveda. Next is Vrishya Chikitsa, that is sexology, that is reproductive medicine, aphrodisiacs. Ayurveda is also very famous for the reproductive medicine. So Ayurveda deals with the Vrishya Chikitsa deals with aphrodisiacs, fertility treatments, reproductive medicines, dealing with gynecological disorders in females, and all the male reproductive system related disorders, to enhance and to maintain sexual health and fertility. So all these eight branches of Ayurveda cover a wide range of medical and health related knowledge, providing a comprehensive system to address various aspects of human well-being. So these are the so it is a myth that Ayurveda do not have branches. Ayurveda has specified eight branches. So these are the eight branches. So the next myth is on, Panchakarma. Before the myths on Panchakarma, what is Panchakarma? We have to know. Panchakarma means five, five. Panchakarma. Pancha means five. Karma means therapies. Is a comprehensive detoxification and rejuvenation therapy in Ayurveda. Detoxification is purification of the body, not the detox diets or the detox therapies you see online. It is completely different from the comprehensive Ayurvedic detoxification and purification. So it is a set of five therapeutic procedures that aim to purify and balance the body and body, mind, and spirit. So, the primary goal of Panchakarma is to remove accumulated toxins and restore body's natural equilibrium. These procedures are typically performed in a sequence or and are tailored. These are customizable. See, Ayurveda one size fits all approach is not applicable in Ayurveda. Ayurveda is highly customizable approach. Every individual is unique, and the treatment of every individual is tailored according to the individual's unique constitutions and health needs. So the five panchakarmas are vamana, that is therapeutic emesis. Virechana, I'll talk about panchakarma in detail in some other session. This is just a brief. So vamana is therapeutic emesis. Virechana is purgation therapy. Basti is enema therapy. These are the five panchakarma therapies. Fourth is nasya. Nasya is nasal administration. Rakta mokshana is bloodletting. So these are the five panchakarmas. And debunking myths about panchakarma, and what are the myths. The actual myth is panchakarma is a one time treatment or a one time procedure. No, panchakarma is not a one time treatment. It is a comprehensive procedure that requires careful planning, preparation, and post treatment care. There are purva karma, pre procedural preparations, and paschat karma, post procedural preparations. So everything needs to be taken care of. Multiple sessions of panchakarma may be required over a period of time, over several days or weeks, to achieve optimum results. It also depends on the intensity of the disease, how is the patient reacting to the therapy, and what is the disease condition of the disease, and strength of the individual. It depends on everything. Okay. And panchakarma is, people think that panchakarma is only for sick people. There is rutu related panchakarmas as well. For the panchakarma is actually highly effective for those dealing with specific health issues. That is true, but it is also valuable maintaining overall well-being and preventing illnesses. So healthy individuals can undergo panchakarma to eliminate accumulated toxins, reduce stress, and rejuvenate the body and mind. So everything, if even healthy individuals can take panchakarma therapies under the controlled supervision of a panchakarma therapist and a panchakarma doctor. Okay. In a panchakarma center, there are rutu based panchakarmas available for healthy people. You will get to know about it when you approach a panchakarma doctor, Ayurveda panchakarma doctor, MD in panchakarma. So This is the myths on Panchakarma. So Panchakarma is a profound and holistic. It cannot be taken at home. It needs complete supervision from a doctor. So Panchakarma is a profound and holistic Ayurvedic therapy for detoxification and rejuvenation. So it requires proper planning, expert guidance, and individualization to be effective and safe. So Purva Karma is a crucial preparatory step that enhances the Panchakarma. So before Panchakarma, that there is Purva Karma, and after Purva Karma there is Paschat Karma. That is after procedure, precautions to be taken. And the next field of Ayurveda is Rasa Shastra, and we'll see the myths in Rasa Shastra as well. So, before coming to the myths in Rasa Shastra in Ayurveda, so we have to know what is Rasa Shastra. So, Rasa Shastra is a specialized branch of Ayurveda which deals with the preparation of herbo-mineral formulations, that is Rasa Aushadhi, for therapeutic purposes. These formulations involve the combination of minerals, metals, and herbs to create potent medicines. But before that, complete care is taken that the metals and the minerals used are purified. There are different purificatory techniques to purify metals and minerals used. So these are not unsafe. So, Rasa Shastra, the term Rasa refers to the essence. Shastra means science. So, Rasa Shastra is the science of extracting the therapeutic essence from minerals and metals to make powerful medicines. So, what are the, like, what are the general myth around Rasa Shastra? The herbal mineral formulations is herbal mineral medicines. The Rasa Shastra medicines are toxic and unsafe. This is a myth. Why? Because while heavy metal toxicity, they have long time back there were cases of heavy metal toxicity, but in modern Ayurvedic practices, they emphasize strict quality control and safety measures. Properly prepared Rasa Shastra formulation drugs undergo extensive purification process to remove toxic substances and then render them safe for therapeutic use. See, you have to adhere to the reputable manufacturers, because they adhere to the stringent guidelines and regularly test their products to ensure safety and efficacy. And while taking herbal-mineral medicines, it should be 100% prescribed by a Ayurvedic practitioner. You should not take it without a prescription. Yeah, and these and Rasa Shastra medicines have no scientific basis. That means some people say that herbo mineral preparations have no scientific basis, but Rasa Shastra have roots in ancient alchemy, but it is not without scientific principles. Modern research has explored the therapeutic of potential of herbo mineral preparations used in Ayurveda. So uh, as I said, Ayurvedic drugs, herbal-mineral preparations also undergo, stringent quality control checks, and they undergo sometimes controlled trials. So researches are, being carried out on herbal-mineral medications. So they are completely scientific based. So and research is going on to fully understand, researchers are still going on to understand the full mechanism of action and everything regarding the herbal preparation. So these are the common, I have tried to cover almost all the common myths that revolve around Ayurveda. So um I have these are the common myths, and we have debunked some of the common myths. I'll see if any is left. So these are all the common things. So, this is it for today's session, and thank you for staying tuned. Please let me know if you want me to address some other topics on Ayurveda, Ayurvedic psychotherapy, mental health, and psychotherapy in general. I would be happy to do that. And namaste for today. Thank you.